So Steve, last year we celebrated AFTO's 125th anniversary by visiting a number of places that are very important to AFTO's history. We went to Toledo and Detroit, and of course we went to Kent, Indiana, the birthplace of Harvey Wiley. Certainly you have something ready for us this year.
You know, maybe this year we should go take a trip and look at those places that have really changed food safety, the sources of outbreaks that changed how we do our work and how we protect public health. You know, I think there was a very, very wise man who said something about you have to know where you've been to know where you're going. I'm pretty sure that was you, Joe.
Me?
Yeah, you. Well, would Lori let you take your suitcase out and go on another trip?
Oh yeah, she's always willing to chase me out of the house. Let's go.
Hello everyone. Here we are, Lake Michigan. Doesn't it look great? Lake Michigan is the only one of the 5 Great Lakes that is totally within the boundaries of the United States. We're here maybe to do a little fishing, but above all else, we want to talk about botulism, one of the more challenging foodborne illnesses that we deal with in food protection. In 1924, the Gerber family from Albany, Oregon, sat down to a dinner which included home-processed string beans. 12 of them would die within days of one another. That story was bigger than the death of President Woodrow Wilson. In 1931, the Hine family from Grafton, North Dakota, threw a dinner party and served a salad that was topped off with home-processed peas. 13 people would die from botulism, including 5 members of the same family. Those 2 episodes of botulism were associated with home-processed foods. There have been a number of outbreaks associated with commercially processed foods. We've had botulism outbreaks associated with canned mushrooms, with canned olives, with tuna fish, with chili sauce. But the one that we associate from the waters of Lake Michigan was in 1963, associated with vacuum packaged whitefish chubs. So these fish were caught by gill nets in Lake Michigan and stored for a day before they were smoked. There were no processing regulations for smoked fish at that time. Most processors would only guess at the temperatures that were employed during their smoking. After having been smoked, the fish were stored for another day before being vacuum packaged. Then a distributor would pick up the product and take it to Tennessee, and he would leave it there for a week before it was sold at retail. It was reported the distributor actually went on vacation for a week and then returned and didn't find anything wrong with the product. The packages weren't blown up. There didn't seem to be any indication of off odor. Marketed that product, and 17 people would get botulism and 5 people would die from eating that fish. So what immediately happened is smoked fish regulations would be created. The state of Michigan, Wisconsin would promulgate regulations, and even the city of Milwaukee's health department would promulgate smoked fish regulations. But AFTO was really impacted because they were invited to become members of an interagency botulism research coordinating committee. This was a national committee that was put together to review research on Clostridium botulinum type E that we associated with the marine environment. FDA would soon add specific regulations for hot processed smoked fish to their general good manufacturing practices, but these would be actively opposed by East Coast smoked fish processors. So FDA was sued and the FDA regulations were struck down. The court said that FDA used unpublished data to justify the need for the regulations, and that FDA had not considered the commercial feasibility of these regulations. So then other states, including New York, North Carolina, and Alaska, would eventually promulgate smoked fish regulations, and AFTO would create a model code that states could consider to adopt regulations. Well, this smoked fish outbreak was really an interesting episode, but an outbreak on the West Coast really turned the food protection world upside down.
The 1993 Jack in the Box outbreak impacted over 730 people. In addition, 4 children died and many had long-term health consequences. This was known as the most infamous foodborne illness outbreak ever.
And as a result, the media coverage was enormous across the country. Again, most of the people that were impacted by this were young children, children under 10. 178 of them were impacted, and as Steve said, 4 of them would die. But those that survived may have also suffered kidney damage or brain damage. But as a result of this episode, a lot of important changes occurred in our food protection community. Not the least of which is the question of what the heck were we doing? Because there was 22 outbreaks prior to the one here in Jack in the Box with this E. coli organism. But as a result of this, so many important things were changed in the way we do our work. Among those important changes were that E. coli 0157H7 would become a reportable disease. Additionally, the food code was amended to increase the recommended internal temperature for cooked hamburgers from 140 degrees Fahrenheit to 155 degrees Fahrenheit. The USDA, Food Safety and Inspection Service, introduced safe food handling labels for packaged raw meat and poultry that would alert consumers to the risks associated with undercooked hamburgers. USDA FSIS also introduced testing for E. coli 0157H7 in ground meat. Most importantly, USDA would reclassify E. coli 0157H7 as an adulterant in ground beef. And finally, USDA would introduce its pathogen reduction passive program.
The Jack in the Box E. coli outbreak will be remembered and discussed for years to come. But there were other outbreaks.
Yeah, I think you're talking about leafy greens.
For those of you that know me, an Atkins diet is pretty easy, or especially the all-meat part to adhere to. I might even suggest a revision to the food pyramid. I see 3 primary food groups: meat, carbs, and of course desserts. It's kind of ironic that I'm standing here in the salad bowl of the world to talk a little bit about leafy greens. Leafy greens are one of those products that have been associated with many outbreaks and made a lot of headlines over the last few years. But we have seen tremendous progress in avoiding contamination over this time. The production has improved. We've also seen a great deal of work on the processing and also the packaging to make a good salad that's safe and uncontaminated for all of you that love salad. But this has really not been an easy road to hoe. In 2006, an outbreak associated with Taco Bell sickened 71 people in 5 states. 52 of them tested positive for the same strain of E. coli, 53 were hospitalized, and 8 developed a type of kidney failure called HUS. Originally, the investigation pointed to green onions, which had been suspected as a cause of a similar foodborne illness outbreak. Eventually, it was determined and traced back to the lettuce farms of the Central Valley of California. Later in 2006, another leafy greens-associated outbreak in Iowa and Minnesota involved E. coli that was traced to shredded lettuce served at Taco John's restaurant. This outbreak resulted in 81 ill and 26 hospitalized. These outbreaks were the impetus for a number of industry and regulatory reforms. 2 of the most important were the California Leafy Greens Marketing Agreement and the Food Safety Modernization Act, which resulted in FDA's produce safety rule. The California Leafy Greens Marketing Agreement, or LGMA, was established in the spring of 2007 with oversight from the California Department of Food and Agriculture. The agreement provides a mechanism for verifying that farmers follow established food safety practices for lettuce, spinach, and other leafy greens. Farmers, shippers, and processors in California follow a set of food safety practices when they sign on to the LGMA and can only buy from member farmers that follow these same rules. The California LGMA has become a model program for produce farmers in other states. The Food Safety Modernization Act, signed into law in 2011, allowed FDA to develop rules related to produce safety, or the Produce Safety Rule. This rule establishes mandatory science-based minimum standards for the safe growing, harvesting, packing, and holding of fruits and vegetables grown for human consumption. This means that farms covered by the rule are held to these standards designed to reduce the presence of potentially dangerous bacteria in the food supply. Further, for the first time ever, many produce farms are inspected by states or occasionally FDA. As we know, regretfully, leafy green outbreaks aren't a thing of the past yet, but hopefully they will become less common and smaller in size with all the changes put into place. Plus, we're learning a lot about prevention with outbreaks associated with leafy greens. It is kind of ironic that something my mother tried to make me eat and still does has been the culprit of so many outbreaks. Speaking of that, who would have ever thought a staple of my childhood, like peanut butter, could also make you sick?
All right, Steve.
There's got to be peanut butter in here somewhere, Joe.
Life Carb Smart.
Yeah.
It's low carb, right?
Oh, there's my kind of food. That's perfect.
Hostess.
Yes. Oh, little
Oh, wait, Debbie.
It's time.
Debbie.
Oh, there's the peanut butter.
Oh, peanut butter.
Yeah.
Boy, we had our problems with peanut butter, huh? We've had some challenges. Who would have thought that this country's greatest sandwich could make people sick? But back in 2008, I believe, 9 people would die, 714 would get sick from peanut butter that they consumed in 46 states. And unfortunately, who eats peanut butter? Most of the victims were children.
Yeah.
The company that was implicated was PCA Corporation, remember, from Georgia, and they categorically denied any wrongdoing in this episode.
Yeah, the episode triggered the most extensive recall ever, with over 4,000 products, 361 companies involved, and $1 billion of impact to our peanut producers across the country. This would end up also having the most significant prosecutions ever for a foodborne illness.
Following a 2-week inspection of the PCA Georgia plant, FDA inspectors indicated the company had information that its peanut butter products were tainted with salmonella, but shipped them anyway after retesting. This occurred at least 12 times in 2007, 2008. In 2007, the company shipped chopped peanuts on 2 occasions, even after salmonella was confirmed by private lab tests. The company had previously refused to divulge test records until federal officials invoked the food safety provisions of a federal anti-terrorism law. The FBI and FDA's Office of Criminal Investigations conducted a criminal investigation. Search warrants were executed, and eventually 4 officials of the company, including the owner, were named in a 75-count indictment on charges related to salmonella-tainted peanuts and peanut products. The government presented evidence at the trial that these 4 individuals participated in several schemes to defraud customers relative to the quality and purity of their peanut products. Basically, they misled customers about the presence of salmonella in their products by fabricating certificates of analysis to indicate their safety.
Federal authorities recommended life imprisonment for the owner of PCA. In the end, he was sentenced to 28 years in prison, the longest sentence ever imposed for a foodborne illness-related prosecution. In addition, Peanut Corporation of America went out of business and went bankrupt.
Yeah, but this was not the last criminal case involving food safety in this country.
Here's your vanilla anniversary brownies with a caramel.
Thank you very much.
Oh, this is good.
Oh, it's very good.
What'd you get?
anniversary cake.
I don't know what that is, but I got cherries, and this is great.
The brownie bites on top and the whipped cream might be more important, though. So, Joe, this kind of reminds me of back in 2015 when Bluebell Creameries issued their first recall in their 108-year history. The recall was issued on several items that were produced in Oklahoma after the discovery of 5 listeriosis cases, and I believe 3 of those patients ended up dying. A sampling program by Bluebell found several positive tests for Listeria monocytogenes in different places and plants, and the company recalled over 8 million gallons of ice cream. That'd be one big ice cream social.
Do you know what I remember, Steve? Is that FDA found that the company was aware of the situation and failed to take adequate protocol that would have prevented the outbreaks from occurring. In addition, they found that 2 years prior to the recalls in 2013 and again in 2014 that the company had isolated listeria from one of its manufacturing plants and did not adequately follow up and investigate the matter at all.
Yeah, amazing. This is a pretty good ice cream.
You know, one thing we learned from this outbreak is that very small numbers of Listeria monocytogenes can cause illnesses such as this. Anyway, the U.S. Department of Justice launched a criminal investigation into Bluebell Creameries to determine what Bluebell executives may have known about the contamination, when they knew, and what they did in response. Bluebell executives were indicted for conspiracy and wire fraud for the alleged cover-up. You know, Steve, in addition to the indictment, the company pled guilty of distributing adulterated ice cream and agreed to pay a penalty of $19.4 million, which was the second largest penalty ever involving a food safety case.
Who would have thought you could go to jail for making ice cream?
I know.
What was the largest penalty ever, Joe?
That was Chipotle Restaurant, who paid a penalty of $25 million relative to an outbreak from their restaurants that sickened over 1,100 people between 2015 and 2018.
Well, Joe, we need to finish our ice cream. It's time to go to lunch.
Let's go. Well, Steve, this journey was just a small selection of the foodborne illness episodes involving pathogens that have caused some real tragic and unfortunate outbreaks.
Researchers have identified more than 250 foodborne diseases. Most of them are infections caused by bacteria, viruses, and parasites. Others are caused by harmful toxins and chemicals.
Yeah, but you know, most sadly, is these illnesses are really preventable, and many just go unreported to public health authorities. They're clearly a burden on public health, and they contribute significantly to the cost of healthcare. They continue to be a real major challenge to our food protection community.
Absolutely. Although anyone can get an illness, some people are at a greater risk for getting sick.
But who are the faces of food safety? I think it's the children. And I think they illustrate the real importance of our food protection community.
AFTO members and the people AFTO represents are the public health officials that are on the front line. They're investigating, they're in the facilities, they're also doing the laboratory work to help determine and investigate and prevent foodborne illness from occurring.
These are all noble professions, Steve, and we understand that there will be more emerging challenges in the future. So perhaps it's time we press on to 2023.
On to Norfolk we go.
Let's go.